A new stroke treatment brings the physician to the patient by helicopter. Saves time, saves money, but most importantly, it can give that patient a better chance at life. Mallory Safostate here tonight with more on the new model being tested at Johns Hopkins Hospital.
Jamie, once someone starts experiencing stroke symptoms, the clock starts. That person needs to be transported to the hospital, then sometimes transported from there to a specialized hospital where doctors perform a procedure that alleviates blood clots in the brain. And when it comes to the number 5 killer and number 1 cause of disability, it's those minutes and seconds that make every difference. In roughly the same time it would take someone to drive from Baltimore to D.C., a stroke victim in Bethesda was admitted, tested, diagnosed, and a specialist from Baltimore was able to initiate treatment. That neuroradiologist was Johns Hopkins Dr. Ferdinand Huey.
I got a call. The neurologist was stuck on 495. They needed some help.
And he was only able to get there in time by flying there.
So borrowing a page from transplant surgery where they fly a doctor to a site where there's a liver, what we did was we fly a doctor, in this case me, to the hospital that has the patient.
He calls it Helistroke, and to his knowledge, Hopkins is the first hospital to try this physician-to-patient treatment model.
If you can imagine transporting a sick patient, you need the nurses, you need the safety equipment, all the monitors. All of that takes time, money, and weight, and fuel is expensive. Transporting me, it's just one person, no monitor, no other people.
He says it saves money, but also precious minutes that could make a critical difference.
If you can open a blood vessel within 150 minutes of onset, you have a 91% chance of having a good outcome.
And he's seen good outcomes before. He's treated patients with debilitating strokes and seen them walk out of the hospital 2 days later.
That's what we're trying to do with stroke. Walk out of the hospital versus never work again. Walk out of the hospital versus staying in the hospital for 2 to 3 months and then long-term assisted living. So that's what's at risk in stroke. That's what we're trying to do. And saving 3 hours in transport could be the difference between somebody walking out of the hospital and somebody ending up disabled.
Dr. Huey has tried this physician-to-patient treatment 3 times now. He doesn't see it as a long-term plan for somewhere like Bethesda. He's currently working with the hospital so that they are able to provide 24/7 stroke care. But for rural hospitals, it could make sense.